Hi everyone, it's Colin Hung here at Healthcare IT Today, and I'm excited to sit down with Blake to talk about some interesting thing he's doing to help combat this COVID crisis. Blake, welcome to the program.
Thanks so much, Colin.
Hey, Blake, maybe for the audience, you can just tell us who you are and what company you represent.
Sure thing. I'm Blake Marggraff. I'm the co-founder and CEO of the health technology company CareSignal.
And where are you located right now, Blake? Where are you coming to us from?
Beautiful, and it really is beautiful, at least best I can tell out my window, St. Louis, Missouri, right in literally the center of all of this craziness.
Wow, you are literally not quite the epicenter, but you are right in the middle of the US. That's amazing, amazing. Well, thank you for joining us. And maybe can you give us like a quick synopsis? What is CareSignal?
Yeah, totally. So CareSignal is focused on remote patient monitoring and engagement, and specifically supporting organizations that are pursuing value-based care to keep tabs on their rising risk patient populations. And I'll share more about that later, but I'm deeply passionate about that problem.
All right. Well, let's get right into it. And the reason for this conversation was I'd heard through the grapevine some of this great work that you're doing to help organizations get through this COVID pandemic. Sounds like you're offloading some really critical in knowledge and work from organizations. Can you tell me more about that?
Yeah, definitely. So honestly, it's been for everyone a pretty incredible past 3 weeks because for those of us in healthcare, we have a really unique opportunity to have maybe more of a positive impact than we ever thought we could. And for CareSignal, that looks like a suite of programs that are specific to COVID and specifically helping healthcare providers and payers do 3 things. One is keep their communities engaged and educated and also connected to local public health resources. So we have a program for that called COVID Companion. Next is help folks that are under home quarantine. Maybe they've just been exposed and are asymptomatic, but more and more, these are folks who are low risk but symptomatic. Help keep them engaged and help them self-monitor so that if something goes wrong, if symptoms get worse, they can automatically be connected to the COVID hotline. And then the third one that I'm super excited about is helping providers specifically, so health systems, hospitals, support their staff by tracking their health, their stress, and finally making sure they have access to personal protective equipment like masks. So those 3, kind of the community, the home quarantine patient, and the staff, those comprise our COVID suite, and it's like you said, it's free. I mean, we're just an opportunity to help.
So you're making all of these tools available to any provider, anyone for free.
Yep, and we've taken it even a step further. We create, we have this down to just a few-minute process. We create customized materials that are branded for that health system or hospital so that their marketing team doesn't need to do even more work. They can roll this out to their community patient staff immediately, and it's all white labeled.
So walk me through that one, just so we can have our viewers kind of understand. So what is that solution that you just talked about where you can roll this out quickly and the marketing department doesn't have to do a lot of stuff?
Perfect. So let's say that this is a health system that's maybe in a tier 2 city, like St. Louis or like Des Moines, right? Where you have, you know that the wave of patients unfortunately is coming and your resources are about to be very strapped. You're going to need to send patients home. You're going to need to tell them, Mrs. Smith, look, I know that you're sick. I'm really sorry, but you should be okay. But listen, call me if anything goes wrong. That's a terrifying thing for providers to do, right? Those are patients who would usually have been given a hospital bed, right? And now that just it's not feasible. So instead, that patient would text into COVID Connect, and it's always white labeled, for instance, OSF here in the Midwest, right? So they would just text OSF Connect, and they'd then be able to keep track, self-monitor symptoms. How's your breathing? How's your coughing? Things like that. How's your fever? And then the really magical moment is, from that patient perspective, if one of their symptoms is getting worse, then COVID Connect will automatically tie them in with that hotline for their healthcare provider. So, I mean, put yourself in the shoes of a provider. You know that your patients are going into something where they'll be, kind of handheld, but then patients always have that resource as well.
So let me understand this right. So I text something Connect, let's say OSF Connect in this example, as a patient, and then do I get like a daily questionnaire via text? Is that, or do I just self-submit stuff? Is that kind of how it works?
Exactly. Yeah, technically both of those, but to make it easy, we send out that simple, just a few question daily questionnaire and capture that information, and then connect to the patient if something goes wrong.
Gotcha. So depending on what my answers are, how I answer that. I can always hit that hotline or get put in touch with the right individual at the hospital.
Yep, exactly.
Amazing, amazing. So that was the Connect one. What's the second one you talked about, or what was the other one?
So there's the community focused tool, which is COVID Companion, and that's again free, no alerts. That's really for folks who just want to have access to the latest CDC tips, recommendations. But we do some clever stuff. So we connect those patients, or we share with them access to their public health resource contact information, so that patients who might not have a primary care provider can still have an avenue to seek out care, and also to make sure they have the highest credibility possible latest information. And that one, we've already seen that adopted by thousands of patients across all, I think 47 states, more than 30 health systems, payers, clinics across the country. We're coming up on 100,000 interactions now, which is kind of exciting.
So is this curated? I mean, so sorry, I mean, the information that you're making available here, is this the CDC's information that you're making available through this?
Exactly. Yep. We sometimes have to make it a little bit less verbose and bring it down to a fourth grade reading level, but that's it. I mean, at the end of the day, there's so much floating around out there. One of the things that we're really trying to do is help providers and payers share with their communities the highest credibility possible information.
Right. So this is a pool of information that, as a patient, now I can access through this system, and I can get all the latest tips and things from like credible resources without the hospital themselves having to curate this stuff. Is that kind of the idea?
That's the idea, and it's also kept up to date. So the provider can trust that it's always going to be the latest, most relevant information.
And are you finding that this, given that you've already gotten some use cases, is this sort of diverting a lot of phone calls? Is that kind of the idea, or is it really just trying to put patients at ease?
Man, that's a good question. I don't have data yet on phone call diversion. In a way, I kind of hope that it just points phone calls to the right place. For instance, where a patient might have just called the hospital to say, hey, I don't think I have a doctor. Instead, they really should be reaching out to their public health department website, right? And seeing, hey, oh, there's a free clinic here, a screening tent, or I can go to here. And at the same time, when if that patient has something go wrong, one of the key tropes that we have in COVID Companion is reminding folks, look, if you get sick, self-isolate. If you get sick and your breathing gets worse, reach out right away. These things that you and I both now hear every single day, but a lot of folks just don't hear.
Gotcha. And what was that third item that you talked about? And that's got you very excited.
So excited. I mean, we're seeing everybody's tackling this problem all at once, and I think we can really help. So COVID staff support. This is a 3-component program. First is providers in particular, for frontline staff, they're not sure what to do. They have to send staff home that might have been exposed and say, hey, just, you're asymptomatic, but let us know. They sometimes have to keep staff on in tier 1 cities that are symptomatic and say, hey, as long as you're not getting much worse, we really need you to put on a mask, put on gloves, practice, best precautions, but we need you to keep working. How do you keep track of all of these different teammates? Well, that's hopefully what we can help with. So we track the health of all of the employees, especially clinicians in frontline, but then we also track their stress levels using a simplified screener and provide evidence-based stress management tips. And then because PPE access is increasingly a major problem, we ask if staff have had any issues, optionally for the provider, we ask if staff have had issues accessing personal protective equipment. And then we drill down to find out when and where that happened. And then it becomes a supply chain question, so that providers can potentially drill in and say, hey, we noticed that there's a shortage of masks at 4 o'clock in this clinic every day. Let's go ahead and kind of reallocate to help staff.
So the idea is similar to what we talked about at the beginning with patients. Now it's staff getting this text, staff being able to self-monitor and answer a quick questionnaire via text message, and that data is then given to the administrators, who can then monitor it for either supply shortages or just the health and mental health of their staff.
You nailed it. Nailed it perfect.
And again, this is free for any anybody any provider who wants to adopt this and have their staff just kind of use it. There's no cost there.
No cost. No cost.
And And how fast can someone roll this out? Like, how long would it take to implement this?
The record is 3 hours from a group saying, hey, we want to do this. 3 hours. And a big part of that is because, I mean, you're not on the CareSignal team, but this is our mantra, right? Low friction. But all the more important here, more important than ever before, getting the word out. We do all of that lift. and we do it, white labeling materials. But even just building the product and scaling it so it's still a customized, high quality experience for each organization. I mean, that's a big part of the approach.
Yeah, that was actually going to be my question. So the organizations, they can customize the questions and what data they want to collect from their staff members through this system.
Just a little bit. So the core product is ready to go, but because organizations might have different resources, some have a COVID hotline, some have a telehealth resource, we've made sure to build in flexibility just in those key areas so that they can point both staff and patients to the right resource.
Gotcha. That's pretty amazing, and I'm not surprised you're getting such an uptick in usage of your platform, given these are the kinds of use cases that you're giving to them. This is for the patients, for the public, and then for their staff. It's pretty amazing.
I appreciate it.
So let's change a little bit and spend just a second talking about what happens after, because I know we're right in the middle of the pandemic and everything right now, but at some point things are going to turn around. At that point, what has got you excited about CareSignal, either in terms of the products you're rolling out or the customers you're going after or the way you help people? What's got you excited sort of for that after the pandemic world?
Right, really, I hate to, simplify it down to when everything's back to normal, but more or less when things are back to normal. I mean, so our focus is on supporting rising risk patients with chronic conditions, behavioral health conditions as well. And we have more than 24 programs: heart failure, COPD, but also substance use, basic needs assessments, even maternal health for breastfeeding adherence, for instance. And what has me really excited is deploying some new predictive models that we've been investing a lot of time and energy in. So, I mean, you're deep in this world, right? So let's dive deep. The whole point about this kind of holy grail of patient engagement is a bit of a misnomer. It should more accurately be called clinically relevant engagement, because you and I engage with stuff all the time, right? But obviously not a whole lot of that helps our healthcare. The same is true for tools out there, right? Portals are great for lab tests. Devices are great for the very top of the pyramid patients. But how do you in a clinically relevant way keep folks engaged for a really long time? And I mean, hopefully we can chat in a few months and hopefully the dust has really settled. But the first step is predicting that someone is going to disengage. That is, I believe that the first truly compelling application of patient-facing AI will not be predicting that a disease will deteriorate, even though that's actually pretty easy. It's going to be predicting that a patient is going to disengage from whatever system or solution is supporting him or her, so that the company can subclinically reach out and re-engage that patient. So that's long answer, short question, but that's what genuinely has me super pumped.
That's amazing. So two final questions. What's the one thing you want to make sure people leave watching this video? What is the one piece of information you want them to retain?
If you're anywhere near the healthcare sphere, head to covidcompanion.com and you'll be directed to a page to see if our free solution is the right fit for you, and then we'll do it. We'll put together the resources for you, for your organization. It'd be a privilege to help. But also thank you. Thank you for your heroic work.
Great. Second question, last question, really. Where can people get a hold of you other than the website you just mentioned?
other than the answer to the first question, shoot me an email. My email is just blake@caresignal.health. Be a privilege to connect. And we're all in this together now more than ever. So anyone.
Awesome. Blake, thank you so much for your time today. It was so interesting learning the good work that you're doing. Congratulations to that uptick, and I hope a lot more organizations decide to take you up on your offer.
It means a lot. Thanks so much, Colin.